Hi, myself Dr. Ankit. I take classes for infectious diseases at Marrow on the online modules, and we have Dr. Sreehari, who's the man of the moment. And hearty congratulations to you. And this is probably the first time we are meeting. I mean, virtually. I really enjoy teaching in person, but these days, obviously, we are doing it a lot through tech, and probably it's helping people out. But before we move forward, just introduce yourself. And also, I just got to know that you did clear the critical care exam last time, right? Just 6 months back,
Yes.
you were ranked one for the critical care. So I would want to explore all of that because then you decided not to do that and do ID. But before that, just for everyone else and for me also, could you please introduce yourself?
Thank you so much, sir. I am Sreehari. I did my UG from MAMC Delhi. Subsequently, I did my MD medicine from AIMS Raipur. So it's in AIMS Raipur that I developed developed an interest in infectious disease because we had an infectious disease program in infancy there. It had just started when I was in second year, and there were two residents who had come. And although the my support from microbiology was just coming up, and all the investigations were just being available, but the thinking process of an infectious disease resident, we got to know, we had a window into that, because the residents used to see the cases from an infectious disease perspective, and the way they interpret the antibiotic sensitivity report, all of them were different. So this was where I was introduced to. Subsequently, I did my SRship from JIPMER, and where I worked in medical ICU. So again, medical ICU, it was all about managing infections, the ICU related infections, and the interpreting the culture sensitivity reports again. And I was lucky to meet up with Dr. Ram Gopal sir and Dr. Ram Subramaniam sir from Apollo ID. That's when I was clear that this is the branch that I want to write this time. So would like to start by thanking my parents. Without whose support, every step would have been difficult, and I would not have been here. Also, I would like to thank my teachers, right from UG to PG, to in JIPMER. And also my in my exposure to Apollo ID, where they helped me understand how to look at cases from an ID perspective, how to make a diagnosis in infectious diseases, starting from a clinical syndrome, and then to reach a microbiological diagnosis of the clinical syndrome, and also address what is the host issue. So just these 3 points, when they taught me. After that, dealing with infectious disease was so easy, because otherwise, if you look at it, microbiology is so vast with virology, parasitology, bacteriology. But when I understood infectious diseases just about the clinical syndrome, then the host factor, and then we reaching the microbiological diagnosis, that simplified a lot. So that's how I
Right.
was brought. I was made aware of how to approach the infectious disease, and transplant ID, of course, is too interesting. That's why I understood that I have to give this exam, and uh, uh, this is what is the best branch, which is closely related to general medicine also.
Right, right. I mean, excellent points because a lot of people are generally confused about the scope of practice of ID, and there are a lot of confusion. But what they fail to understand is probably infectious diseases is medicine at the like it's core medicine and nothing else. And you just specialize in infections, and most of the times when you're dealing with hospitalized patients 50% of the time you're trying to deal with some or the infection related to some or the other organ system, right? And you might try everything, and at the end of the day, if you're not able to make the diagnosis, treat the infection, then the outcomes are not great. And infections are something that everybody's supposed to treat. As ID physicians, you don't expect to see all infections admitted in the hospital, because for example, if you're a 1000 bedded hospital, you'll end up seeing like 300 cases in a day, right? If you got to see all infection cases. So it's more about critically analyzing a difficult situation. And then when you're working as an infectious diseases physician also, it is basically you're practicing medicine. Patients don't come with a label of infection, right? They come with a problem, and then you go there as a detective. You think about infections, but not just infections. You see the patient as a whole. So, but before that, I mean, I just want to understand a little more from you. Like, are your parents also doctors? Did they help you in decision making in some way? And did you really join critical care and then decided to leave it to pursue ID, or you were just preparing for ID again?
So my parents are not doctors. My dad is retired. He was in the forces. So my choice to take infectious disease was solely by me, because I wanted to remain in general medicine or to go to a branch which is closest to general medicine. So two branches were there, either rheumatology or infectious diseases. But then I found that infection is just a one-time phenomenon. If you diagnose the infection, you treat it with the right antibiotics, the patient is cured. So this is very satisfying to see that when we reach the diagnosis and when patient completely recovers. And not only that, there will be too much history taking to it, epidemiological history. So much rich history is there to take in infectious disease. So this is what is rewarding, especially if you are someone who is interested to stay in general medicine.
That's true. That's
So
true.
this
That's
was the
absolutely
reason. This was the reason I chose infectious disease.
right. Right. I mean, that's really, good to hear about this, because the other thing I wanted to understand is, like, still people are figuring out about the branch, and there's a lot of questions with respect to, what career do we build out of an ID physician. So how did you navigate through those scenarios? I'm sure you would have come across this thing that, like pay and employability and what do you do as an ID physician. All of this must have cropped up. So how did you navigate through that?
Yeah, sir. I discussed with many of the my seniors and the consultants who were working in Apollo ID. So considering the transplant is booming up, and transplant related infections are coming up along with the transplant programs in all the institutes. And it is very clear that as general physicians, it is difficult to manage the transplant infections. So there was no doubt about it, about the scope of infectious diseases. So that's why I was not in doubt whether infectious disease will offer me, if there will be problems with employment or opportunities in different hospitals.
Right. And I would just like to add, because you've talked about infections and transplant patients, but a good amount of your work would also go into stewardship, hospital infection control, and you'll be able to see the kind of impact that you can gradually make in any, work environment. When you'll see that, month on month data is looking a little promising. Few less patients are dying of drug resistant infection. Even that is equally rewarding as, treating a single patient and curing them of infection. I mean, that's a really really valid thought, because a lot of specialities have become about chronicity, chronic illness management, whereas ID is one of those branches where you diagnose, treat, and then you say goodbye to the patient, and then, they live happily ever after, if you're doing the right diagnosis and right management, of course. Now let's talk about the exam a little bit. So, how did you go about preparing for your exam? What were your, or any insights that you want to share? Also, talk about the interview experience that you had.
Once I was done with the syndromic approach, then I went into the microbes. So the microbes, not only from the Marrow SS and Harrison part, I went back to microbiology because I had run. This was one more good thing that I felt about infectious disease. Again, I went back to basic sciences, which I read in microbiology, and I first started from the microbiology part, and then I went into the my clinical part of the microbes from Harrison. So once I was done with both of these factors, both of these parts of the infectious diseases part, then I went. Most of the topics were done. After that, it was just about the miscellaneous parts such as antimicrobial stewardship and transplant ID.
Right,
So
right.
the transplant ID, I felt the Marrow SS videos were so helpful because transplant is something which I was not exposed to at all, and how to deal with CMV, how to deal with BK virus, adenovirus, all of these I had never come up in my PG training program. So Marrow SS videos were so much helpful, especially with the transplant videos part. And
Right.
antimicrobial stewardship was also very, very, everything was summarized in a very comprehensive form. And apart from that, the hospital infection control is also another topic which I feel has to be focused separately. So these were the miscellaneous parts I had read after I was done with the clinical syndromes and the microbiology.
Great, great. So, are there any specific areas you would want, other candidates to focus on when they're preparing for the exam?
I think the paper is more of microbiology, because there will be questions which will be asked from the microscopy, such as they had showed microscopy of Plasmodium malariae band form. Similarly, they had asked questions regarding Cryptosporidium, the species of which. So I feel it was more of core microbiology. So what I would advise is, especially the candidates who are preparing from the MD medicine background, they cannot ignore the basic microbiology which they had learned in second year. So the good thing is, although it is core microbiology questions will be asked, these will not be from an MD microbiology level. These will be from this same microbiology that we had learned in UG. So at least what I recommend is that the microbiology that we learned in UG has to be brushed up beyond doubt. And that will be very scoring, because I felt very comfortable during the entire exam, because so many questions were asked from microbiology which was learned in UG and which are very easy to answer.
Right. That is absolutely correct. And the problem when we, design a module for something like infectious diseases is that it is like covering the entire medicine, you know, and it's really, really difficult. And it's not just medicine, and then it's medicine and microbiology, which are two huge subjects, because microbiology in itself is a huge branch where people are specializing in bacteriology, mycology. Everything has become a subspecialty, so it becomes really difficult sometimes to prepare modules that are informative, but at the same time they don't overload you with a lot of information, because at the end of the day, with our teaching modules, we want you to answer certain questions which should be good enough to clear the exam, because other than that, it's what you're going to learn in the next 3 years of residency, and that cannot be summarized into certain classes, especially because infectious diseases is all about probabilities. Some things are there or not there, and then you try to make sense of it, and you learn as you start practicing. But anyway, very valid points, very helpful points. And once you cleared the exam, how was your experience with the interview?
Um, Sir, in the interview, there are certain topics that when I inquired with the PGs who had done from AIMS Delhi, they had told there are certain topics which are always asked, and that was again asked, because adult immunization is something that we cannot ignore. So adult immunization, they had told that a question will be asked, and adult immunization, they had asked the question. Second, mycology, I feel, is a area in which is very much researched in AIMS Delhi. So mycology, I was told that mycology question will be asked. I read mycology, but still they went in depth and they had asked a question on pheohyphomycosis, which I actually did not know. So mycology also needs to be focused, at least for the interview. Apart from that, they will ask if you are updated about what is going on in recent news. Like for example, the infection. I am from Kerala, so they had asked what were the recent infectious outbreaks that were happening in from Kerala. So they will definitely check that if you're just simply reading theory, or are you updated about what are the infectious outbreaks which are going around recently. So these are some of the things which will be different from theory. Otherwise, any topic from the theory can be asked.
Great, great. And anything specifically you want us to, update in the modules? I mean, we are working on adding more topics. You would see that we have already added a lot of more topics, and we are on the way to, add certain more topics. But any specific areas where you feel a little more detailed discussion would help, or something that is absolutely not covered and should be covered?
Uh, Sir, I feel if the UG microbiology videos, if they can be integrated into the module, I feel this will help because ma'am has covered some topics which because ma'am was focused on more of microbiology than the clinical syndromes, whereas our clinical videos from Marrow SS will be was covering on the core clinical syndromes along with transplant ID and antimicrobial stewardship. So I feel in case both the video lectures can be integrated together, that will be a comprehensive 360-degree analysis of the entire infectious disease program. Like more than that, I don't think anything needs to be covered.
Right. And also, do you feel that some of the clinical topics, do they need to be dealt in with more details? Because we have to think from exams perspective also. The idea is not to, complete in entirety. What we want is that most common areas in exams, everything should be covered. So do you feel that certain areas that can be dealt in with a little more details, or the kind of seem okay to you?
The depth, I don't think the depth was more depth is needed in each of the videos. The videos goes into detail of each topic, sir. Whatever videos are there are covering whatever relevant necessary information is there. It's just about how much of more topics are covered. So considering that microbiology is so broad and so many topics are there, I feel that the different viruses, different fungi which are uncommon and which cannot be covered in it cannot be covered in an entire video lecture series. That may be integrated from the UG videos. Otherwise, with respect to depth of the topics which are covered, that is not needed, sir. More detail is not needed. Whatever is relevant is covered.
Got it, got it. And the other thing is, like, I'm sure you're going to choose AIMS Delhi, right? Or you're trying for PGI Chandigarh.
I'll be choosing AIMS Delhi infectious disease programs.
I mean, it's a great place to work at. You might find that the work is a lot, but don't worry about it. Excellent caseload, excellent academic program, teaching program. Trust me, I've been to Toronto. I've worked with ID physicians from all across the world, and at the end of the day, I never felt that the training was lacking in any form. If at all, the clinical sense, clinical judgment that you will develop, especially if you're interested. See, in such programs, everything boils down to how motivated or how interested you are, in trying to diagnose a case, follow up a case, how devoted you are to clinical work. But by the end of it, trust me, the kind of exposure you will have, very few people would be fortunate enough to, have that kind of exposure. So before we end, I mean, of course, hearty congratulations once again to you and your family. Uh, what do you really expect out of this 3 years of training? What do you think you'll be doing 3 years from now?
Sir, what I expect is just to continue. I am sure that this branch will allow me to continue my practice of general medicine because the consults I am sure will be from different departments. For example, a patient in gastroenterology and even the departments like orthopedics, I'll get to see patients from there as well. So my expectation from infectious diseases just that I want to continue with my practice of general medicine. And after the 3 years, I am not sure if I'll continue general medicine and practice infectious disease alongside, or I will go into core infectious disease. That I have not been able to decide, sir.
That's fine. That is fine. That is too early also because, for example, I was exactly in the same position as you are. And I always believe that I want to continue doing internal medicine. But trust me, I've got no time for internal medicine. The entire day just goes into ID work and that's it. And you'll actually end up doing more than internal medicine because you'll be dealing with surgical branches, pediatric patients, transplant patients that generally internal medicine people will not come across, right? So, but anyway, all the best. Again, once again, lots of congratulations. And do let me know if there's anything, any kind of guidance you need with respect to the place, with respect to AIMS, anything. Do feel free to contact us. Okay.
Thank you so
All
much.
right. Thank you. Bye bye.